Is generative AI potentially an existential threat to the human species?
Some people say this is just science fiction, but sometime in the next 20 years, these things will get smarter than us.
The use of technology is irresponsible in certain domains, so trusting that young people can be leaders, but also that we still need to support them.
How we teach the use of AI for children.
Young people and all of us actually can take control of it and make it something that works for us, not against us.
Hello, my name is Ben. We're here over at a very inspiring event about the use of AI and how it has affected the youth. And I just wanted to learn a little bit more about your organization, Sanvi, and what you do here.
Hi, I'm Sanvi. I'm a student at UC Berkeley. I'm a senior studying computer science and legal studies, and I'm the founder and executive director of a nonprofit called the Youth Power Project. We focus on bringing young people with adverse health experiences into state and federal policy spaces. So we empower them to learn about the legislative process, and to write laws that shape their experiences. So we worked in this space a lot. Obviously, mental health intersects with tech in a lot of different ways. And so this was a really incredible panel and incredible space. And I love the work that the organizations that organize this do in general. So I'm always really excited to come out and support.
Do you have a favorite topic that you've done maybe in the last 6 months?
Okay, AI is my favorite topic. That I promise I'm fun.
So there was a cool message about kind of some of the impact of AI and it's how it has affected the youth, how it's going to affect the future of the youth. Is there anything that you want to let people know about young people and AI, and also the older people, in how we can responsibly educate the children about that?
Yeah, I mean, one is that obviously young people, they know their experiences best. They know how they're using technology and how they're interacting with it, but that doesn't mean that they're best equipped to use it responsibly or in a way that's safe. So I think we need to have more open and honest conversations that happen intergenerationally between parents and children around where technology can be is most useful versus where it isn't. I've heard of really incredible models where young people have come forward and talked about the ways that they think the use of technology is irresponsible in certain domains. So trusting that young people can be leaders, but also that we still need to support them. There's no one or the other. And also that while there have been a lot of stories in the news of how AI has been really harmful to mental health, there are also incredible use cases of where it has been really, really helpful at enabling access to care. So just understanding that there is no one way to interact with these technologies and these services, and that everyone's experience is different, is really important. Obviously, we should understand what goes wrong and use that to make sure that we mitigate the harms as much as we can maximize the benefits. But I think that really leveraging lived experience, creating more feedback loops between users and developers can also really be helpful in that space.
Awesome. Yeah, really, really interesting themes coming up about just how we can use AI responsibly in this generation, and we're gonna wrap this up. I'll let you kind of get home. I know you just delivered this long message. Thanks for staying just a little bit longer with us. I'm here with David at Mental Health for Youth People, and I just wanted to ask a quick question, David. Do you happen to know what music therapy is?
Well, I can guess that it has something to do with helping people process their emotions through either playing or listening to music. Is that right?
Yeah, that's absolutely a huge part of music therapy, the emotional side. We also help with relationships, communication with others, using music in a way to kind of enhance that, just like a therapist would. In a therapy session, we just use music kind of as the vehicle. When you think of who's on the receiving end, does a certain population come to mind? Certain type of person come to mind?
Well, I know from our teenage son who knows a hell of a lot more about music than I do and appreciates it and knows the nuances of all different types of music and knows all the new artists who I've lost track of. And so I can guess that young people resonate to it because music is such a big part of their lives.
Yeah, so music therapists definitely work with young people. It's a big part of the population, but we actually work from womb to tomb. So we actually work even before the baby's born, in prenatal care, all the way to hospice at end of life care, and everything in between.
And beyond?
And beyond, yeah, and beyond, yeah. So it's a fun saying we have in the music therapy community. But when there's a need, there's the music for it. And I have just one. Wait, you were gonna say something?
I was going to say when my grandmother had a stroke and she was dying essentially. We would sing to her, and it's a wonderful world which she loved, and so and you could see the smile even though she was not able to respond.
Mm. And isn't that amazing how you can respond to music over like a familiar place or like a familiar name sometimes?
I think it lodges in people's subconscious, and it sort of persists even when their other faculties may be leaving them.
Yeah. Yeah. I work in a little bit of dementia care as well. So, yeah, it's truly amazing to see the brain literally light up. And that's backed by neuroscience as well, actually. So music activates every part of the brain at the same time. So those memories that are made musical, so that's not just the hippocampus being fired, it's actually the amygdala, the emotional control center of the brain, the communication, all being worked at once. So that's why those music memories are so profound. We know it to be true, but now we have the neuroscience to back it up.
We love
which
that
is
amygdala.
yes, exactly. Everything firing at once. And I have one last question. Is there anything you would like to know about the profession of music therapy?
About the profession of music therapy. I guess, yeah. How do you take all that science and knowledge about it, but actually turn it into something that, is a tool or is a service or something that people can actually take advantage of?
Yeah, absolutely. So within music therapy, our goal is always to provide the tools for the clients to be able to do it on their own, right? So whether that's writing a song with them and showing them how to do it, right? Whether that's kind of diving into the music making itself, playing an instrument, improvising on an instrument, right? We really involve them in the music process as well as in the music conversation and really get them aware of how they respond to music, how the music around them is impacting their daily life and kind of improving their relationship to music. So it's beyond just an experience that makes them feel better in the moment, right? It's something transferable to their everyday life.
What's an example or a story of somebody or some place where you've seen it make a difference?
I would say some of the songs that we've written, I've had some patients where they've just been really like depressed, feel like they can't really do anything. And just that completion of a task, and also being able to do it in the group. So one of my favorite things, I work in inpatient psychiatric care, and one of my favorite things is to pass around, I call it passing the torch of lyrics. So everybody kind of contributes together to a song. And then once that song's written, I grab my guitar and I turn it into music on the spot, as well as I can with my musical ability. And just like seeing people's eyes perk up, it's truly amazing.
Theater of music.
I try my best. And what's like a 2 out of 10 in my head might be an 8 out of 10 in someone else's head. So that's the goal. We're like process over perfection for sure. But yeah, David, thank you for this little interview here at the end of the event. I appreciate your message as well, sharing about why AI is so present right now in with the youth that we have. It was truly an amazing message to hear, and also the implications of why we need to essentially tread carefully right now, and with how we teach the use of AI for children. Yeah.
And how young people and all of us actually can take control of it and make it something that works for us, not against us. No, just I'm heartened, people make use of technology in the way that that's for good and for bad. But I think, I sort of believe in the innate goodness, and people will take those tools and hopefully make something good for themselves and for their community.
Alrighty. Thank you so much, David, for your time. Appreciate it. I also do work with like the adolescents, and like there's some of their family dynamics are just wild. Yeah. I don't work as close with the families, but I hear from the caseworkers and like the social workers in the hospital that it's just like, all sorts of stuff, and like, yeah. I mean, there's, like CPS, like cases and lots of stuff that goes on in the household. So yeah, there's definitely like that dynamic's really important because you see like, it's usually the ones that have it the hardest at home that like have all the, behaviors that just like lashing out, and it's just learned behavior, so yeah.
What age range do you mostly work with?
It's mostly adults. I would say 75% of my caseload is adults and 25% is kids. Yeah, adolescents around 12 to 17. Yeah. It's kind of interesting because with the adults, the problems are like, I guess like they're more like adult. I mean, yeah, they're like, more like fiscal things, but like with the kids, like it's really about like the relationships and feeling, I mean, it goes both ways, but yeah, generally like the kids, like, this person betrayed me or this happened to me, and like, getting over that trauma is like part of the battle, or, working through it, even if they're not going to get over it, But generally, yeah, we come in, we do some of their favorite songs. We do a little bit of songwriting as well in the group, which actually I've been using AI for, which has been cool. Like Suno, if you all know Suno. Yeah, I've like started introducing that to try to, let people know that they can make a song too. Make a song, but at least like hear like. But it can be like a nice reflection thing, like, like you don't know how you're feeling about something, and then like you kind of put that into a song as well. So, but yeah, songwriting, and then we'll do some live music. Sometimes they're playing the instruments. If there's a musician in the room, sometimes they're like dying to get their hands on a guitar or a piano. So I'm like, take it away, So you got to kind of adapt because every session's different. Some you'll have someone trying to strangle someone in the middle of the session. That actually just happened on Friday, which is why I'm laughing. Yeah, in the middle of my session, like someone came in with like a pillowcase and tried to like kill someone. So yeah, but
Police came on it.
yeah. It's like it's kind of wild. Sorry?
You guys are playing rock music?
We do rock, we do rap, we do funk, we do country, everything in between, because it's really like I said, it's like centered around what they want, and what's going to be the most helpful. So, yeah. I've been playing piano like since my whole life. I always thought that like just being a performing musician was what I was going to do. But then, so I declared music business major at University of Miami. But then like right before I started school, I had like a little bit of falling out with my mental health. So I actually got put into inpatient psych myself. So I kind of got to experience that. And after getting out of that, getting better, yeah, it was like, I saw the lack of like music therapists in that population specifically. So I just wanted to kind of be that person I didn't have in there.